first day of the week, a Monday, the first day of a brand new month, and a great day to learn about a mosquito-borne virus that you've been hearing about. It was just reported on ABC News a couple of minutes ago, Zika. And folks, with that in mind, we're going to find all about how this virus infects people, what we have to do to learn more about it, and nobody better to teach us than Dr. Robert Caldas, the Chief Medical Officer for Southcoast Health, and one of the most wonderful people I know. Yeah, look at that smile. I like that. Good morning.
Good morning.
Nice to have you back again.
Nice to be back.
It really is. You bring a wonderful balance of energy wherever you are. It's who you are.
Thank you.
You're very welcome. How are you doing?
I'm great.
Glad to hear that. Over the last couple of weeks, we've been hearing Zika, Zika, Zika. And I remember reporting on it just about 2 or 3 weeks ago with most especially pregnant women.
Yeah.
So let's start here. Few of us have immune defenses against viruses. So how is this thing spread? Tell us a little bit about it.
Well, the Zika virus belongs to a family of viruses called the flaviviruses, and probably one of the better known members of that family is West Nile. So like West Nile and the other members, you need a mosquito to actually spread the virus. It's not spread like the flu with a cough or cold or infected, tabletops. It's spread strictly by the mosquito. Unlike West Nile, it's not a severe disease. West Nile has potential fatalities. Zika has not been shown to have fatalities and is a very mild, self-limited disease, usually lasting 3 to 7 days. People may get fever, red eyes, some joint aches, or a rash, and then it's gone. 1 in 4 people who are bitten by the mosquito will only get the virus. The other 3/4 don't come down with the disease. And really, it's become more known because of the association they found with the Zika virus in pregnant women and a birth defect called microcephaly, where a very small head is found on the infant. They've seen this in 2 countries or countries where it's been associated, although they don't really know the exact mechanism of that.
How small is the head of the child?
Probably half the size that you would expect for a normal child.
All of this because of that virus?
Maybe. They haven't worked out the mechanism, but they've seen the association in those countries.
You just went through the symptoms that most adults have. What exactly is it? You said microcephaly?
Right, which means small head.
Small head. Do adults have an immune system that can endure this disease?
Yes.
Okay. So that's very important to know.
Yes, it is.
Even though we had one report last week at Mass General.
Right.
So somebody obviously
went to an area where Zika existed, was bitten by the mosquito, got the illness, and came back home.
Yes. Now, millions of people in tropical regions of the Americas now have been infected, but they're going to be okay.
They'll be okay. They'll have an illness for about 3 to 7 days, and they'll recover.
Where did this thing come from? Well, how was it? Was it always in South America, Central America?
Initially found in Africa, and then probably around 2014 had actually spread to South America, and then discovered in Brazil recently in 2015.
So is it a new disease, or has it been around for decades and we're just now getting concerned about it?
It may have been around for quite a while. It was first discovered back, I believe, around 2007. So for us, it's a relatively new disease, but it may have existed and just never had been classified.
As a doctor, and by the way, if you're just joining us, Dr. Robert Caldas, Chief Medical Officer for Southcoast Health, joins us. As a physician, would you warn pregnant women not to go, let's say, to these areas?
Yes, I would.
Yeah.
And importantly for us, 14 territories in the Americas have been identified, and one of them is Puerto Rico. So a lot of people in this area travel there either to see family or for vacation during the winter. I would advise against pregnant women traveling to Puerto Rico.
Right.
If you do travel to an area where there are mosquitoes, then the typical controls, wearing long sleeves, staying inside or in screened areas, using approved insect repellent are the general measures you should take.
And you'll know you're infected by the symptoms that you just described a few minutes ago. Is there a test that we can take to see if I have Zika or not?
There is a blood test, but it's actually not done locally. It needs to be sent out presently to the CDC. It's a fairly new test, and they really haven't ironed out all the kinks yet. So it's a test that we could draw the blood locally, but then would have to send it off to the CDC.
Are some of these viruses silent infections, meaning they're really tough to diagnose?
They are, and Zika is one of those viruses. Up to 80% of the people who have it may not have any symptoms at all. Those that do get the symptoms get those mild symptoms that we spoke about.
Yeah. So I'm pregnant. Do I look it?
We need to talk.
And I recently visited a country where Zika is prevalent. What do I do just in case if I'm pregnant?
You need to make sure that you protect yourself against the mosquitoes with the measures that I spoke about previously.
Should I take a test? Should
No.
I? No. All right. That's pretty much. Is there a treatment for
No.
Zika? There's no treatment.
Symptomatic treatment, like with most viruses, if you get the flu or if you get a common cold, you're really treating the symptoms, fever, the joint aches.
Right. Is science working on, if there's no treatment, obviously there's no vaccine, so is science working on some way to prevent it with a vaccine? Or?
I think we don't know enough about it yet to determine whether or not we want to put our efforts into developing a vaccine for something that may be self-limited. I think we will need more information.
Vaccines take many years also to develop.
Yes, they do.
You know, folks think, oh, well, it's overnight, we're going to have a cure to this. It takes a long time and years to develop as they go from concept to needle, right?
Right.
And I guess that is one of the main reasons why you parents listening ought to encourage your children to be more in the science and mathematical fields so that you can become the future, discoverers of greater vaccines. Right? Right. What else would you like to let our audience know about Zika, and what should we really be concerned about?
I think a couple of points that we've spoken about. If you're pregnant, please do not travel to an area where Zika exists. You don't have to worry here presently. If someone comes back with Zika, it's not spread like a respiratory virus. It actually needs the mosquito vector, and right now Mother Nature is helping us with no mosquitoes.
Yeah.
So you could be standing next to someone with Zika and not contract Zika from that person. So it's really a very self-limited disease.
Southcoast Health has always been right there. Where can we go for more information? Is there a website?
Yes, there is.
Yeah.
There's more information available on the CDC website, which is cdc.gov.
Sure. Dr. Robert Caldas, Chief Medical Officer for Southcoast Health. Anything else you'd like to add?
Good morning.
Oh,
Thank you.
No, thank you. It's always a pleasure. It's nice to have you here. When you see Peter Cohen or Tony's doing a great job lining up all of these interviews with Southcoast Health, we're very grateful.
I will. He's a great guy.
Thank you so much. We'll be back, folks. We have the improbable question coming right up.